please remember that safety always comes first. Practicing these techniques can cause physical injury. Always consult your physician before starting an exercise or physical training program. We encourage you to train and practice the techniques retailed in these DVDs, but please do so in a safe and sensible manner. Never train with real weapons. There are safe and inert training aids available. Respect your training partner and wear protective equipment as appropriate to your training activities. Also consider supplementing your training by working with a good instructor.
My name is Dr. Slava Shutt. I'm a doctor of physical therapy. I'm also a CSCS certified strength conditioning specialist by the National Strength Conditioning Association. I'm a certified athletic trainer by the National Athletic Training Association, and I'm the current co-owner of Back to Health Physical Therapy and Aquatic Rehabilitation. We do a lot of different things at Back to Health Physical Therapy. We treat a lot of functional injuries. We treat a lot of surgical injuries, accidents. So we do a lot of different things here to get people back from point A to point Z. With the military, one of my clinical internships while I was going through school or residency was with the U.S. Coast Guard. And I got to see the people first day off the bus, scared, running off the bus, getting into formations, and and I saw basic training, and I saw a variety of injuries. The fire department and police force, and we started, doing a lot of functional type things and reproducing from point A when they were more injured, not being able to do much, to being able to do a whole host of things that basically reproduce their jobs. So when they left us, they were able to go back to work, and believe it or not, a lot of people after injuries actually became better than they were before they came in. Physical therapy actually started as a nursing profession that helped World War II soldiers get up out of bed. We started with basically nurses that were helping doctors get wounded soldiers up and moving again. And that's how the profession actually started. Physical therapists in general are the neuromusculoskeletal experts, and we provide the best possible care to a variety of individuals and injuries here at Back to Health Physical Therapy. Warm-up is absolute key. If you don't have time to warm up for your activity, you don't have time to do your activity. I'd like to introduce my friend and my business partner, Dr. Ian Novotny. He's going to talk to you about the differences between static and dynamic stretches.
When preparing for physical activity, it's important that preconditioning and warm-up is performed in order to increase performance as well as prevent injury. But what are our options? Traditionally, people have performed static stretching in the past. This is a low-grade, low-intensity lengthening of the tissue in order to prevent injury. However, we don't function statically. Krav Maga is performed dynamically. So our warm-up should suit or be more specific to the activities we're going to perform. Dynamic activities encompass movements through specific patterns, which are going to precondition the tissue by increasing extensibility, accelerating or increasing tissue temperature, making the tissue more flexible, increasing glide of the tissue, whether it's the nerves or the muscles on each other, and increasing length and range of motion of all the joints. Preconditioning of the tissues will prevent injury by allowing you to move through movement patterns without resistance. With increased resistance through those movement patterns, that results in hamstring tears, groin pulls, impingement of the nervous system, tears in the muscles. Those are the injuries that you're trying to prevent. In order to simulate the motions that will help to prevent those injuries, a dynamic stretch or dynamic movement patterns help to prevent those injuries by preparing the tissue to go through those specific movements.
Now we're going to give you some examples of some dynamic stretches that can be used for Krav Maga. Now, in no way are these to replicate anything that's being taught technically about Krav Maga. These are just intended to get you moving and warmed up.
When performing the dynamic stretches, it's important that you stay within the means of your body. And what that means is you have to stay within appropriate or safe ranges of motion in which your body is comfortable, and the intensity will build. As your body becomes more flexible, as the tissue becomes more preconditioned, you'll be able to increase both the intensity of the movement and the range of motion of the movement. The exercises that we want to show you today can be performed in a small space depending on your limitation. As you build the intensity, you can increase the length and the repetition of how you perform these exercises, at the same time building intensity to bring you from a cold start to be prepared for a high-level activity. The first exercise that we want to show you simulates a kneeing motion which brings the knee up as well as pushing off on a plant leg. In order to condition the muscles for explosive activity, not only do you have to move through the available range of motion, but you have to activate the muscles that are involved in push-off, hip flexion, as well as balance. First, notice he lifts his knee, performing hip flexion. The stance leg is pushing off, engaging the calf muscle, which has to be warmed up for pushing motions or jumping motions. Again, the hip comes up, knee comes forward, the bottom leg pushes up onto the toes, engaging the calf. During kicking motions, the stance leg is involved in providing stability to the body, as well as the swing leg, or the leg that is performing the kick, has to go through an explosive range of motion. The tissue has to glide along underlying tissue, along nerves, and along bones, as well as moving freely through the available range in order to prevent injury. During the standing reach, you're standing on one leg. The hip is pivoting. At that point, the spine must come straight forward, staying in a neutral or a straight position. Don't let the back sag down or arch over. As you engage the hip in the stance leg as well as the swing leg, the muscles around the front, the back, and the sides of the hip are engaged to provide stability as well as a dynamic movement. Trunk rotation, punches, lunging, squatting all involve the joints of the ankles, the knees, the hips, as well as the trunk. If the spine is moving freely, the muscles around the hips and the pelvis have to have the appropriate length as well as glide in order to prevent restriction in movement, which will lead to repetitive stress injuries. The back hip is actually opening up or extended back in order to increase reach and stride length. Rotation of the trunk occurs staying in neutral spine in order to protect the small muscles around the back as well as incorporate your abdominal muscles that perform rotation. Shoulder motion, reaching or opening of the shoulder capsule will help to increase motion and prevent injury. By gliding the tissue through the movement patterns such as kicking as well as reaching, pulls the nervous system, the spinal cord, and the peripheral nerves through the tissue as well as lengthening the muscles to prepare you for high-level activity. In order to warm the hamstrings as well as increase their extensibility, dynamic movements which stretch or elongate the hamstrings will help to prevent muscle pulls as well as the pull of the hamstring on the pelvis, which can lead to low back pain. The spine must stay in neutral, upright. The hamstrings are moving forward through the kicking motion. Changes in weight or weight shifting allows the body to absorb the weight of the body as well as forces that are put through the body as you move through pivoting motions as well as lunging motions. As you shift, the knee bends forward, lengthening the muscles on the inner thigh or the groin. Shifting of the weight helps to open up the hips, lubricating the joint, increasing movement laterally or side to side. Incorporating the shift of the weight brings the weight onto the hip, engaging the thighs or the quads, and at the same time lengthening motion through the hip and the trunk. Trunk rotation as well as shoulder engagement has to occur so that your body moves in appropriate alignment, as well as with movement of the muscles that are involved in a punching motion and trunk rotation. In order to simulate punching motions, multiple planes must be involved. Punches can be performed in all planes, whether it's an uppercut, a hook, or straight punches. In each case, the trunk or abdominal group is involved in rotation, as well as lengthening of the muscles that come across or forward as the punching motion is performed. For dynamic warm-up, movement through those ranges of motion in all planes is important in order to prevent injury and increase performance.
Warm-up is an absolute key. There was an old philosophy that you had to hold stretches, or what's called static stretching, in the past, and to warm up for activity. But there's a lot of recent literature that shows and demonstrate that actually that is not the most effective tool to warm up. It's actually more dynamic, more specific activity that is actually better for warm-up than static stretching.
Once you've performed your dynamic stretches, the tissue is warm and elongated. From there, you can perform your activity and your training. Once you've completed your training, static stretching becomes more appropriate for cool down, as well as increasing range of motion and tissue length for the future. Static stretching can be performed of any muscle group by elongating the tissue. One appropriate exercise or stretch statically can be performed by tilting the head to the side, pulling with the opposite arm, dragging the arm across, opening up the neck and the shoulder. The muscles in the chest wall close off the shoulder joints. In order to open up the chest and increase motion in the shoulders, a stretch where the elbows are pulled back, hands gently resting behind the neck, can be performed with cervical extension to increase motion in the front of the neck. The posterior capsule, or the back of the shoulder, when tight, restricts movement for punches as well as reaching across the body. This can lead to impingement or pinching of the muscles on top of the shoulder. That leads to injury. Static stretching can be performed by pulling the arm across the body, using the other arm to provide some overpressure. The muscles in the legs, as we had talked about before, pull on the pelvis. If the pelvis is being pulled out or pulled forward, the spine moves out of neutral. Most important, the hamstrings wrapping around the back of the hip, pull the pelvis, changing the position of the spine, leading to hamstring tears or low back pain. A figure 4 stretch can be performed by gently resting the foot on the opposite leg, letting the knee fall to the ground, opening up the front or the capsule of the hip. Trunk rotation, as well as motion across the shoulder and the outside of the hip, can be performed to statically stretch or elongate tissues that are involved in rotation. The quadriceps muscles, the muscles on the front of the thigh, are involved in sitting, squatting, as well as kicking, can be stretched by bringing the hip back and the knee flexed, pulling behind with the opposite arm. What we have shown you are just a few examples of all the stretches that can be performed statically. Static stretching is to be used as a cool down, as well as to increase tissue length over time, performed repetitively. When performing these stretches, the stretches should be held without bouncing 30 seconds at a time and can be repeated 3 sets after each exercise. Now that you've seen dynamic stretches to warm the tissue up, to prepare your body for physical activity, you've performed your training with appropriate technique and cooled down the right way, you're ready to go out there and perform at your peak.
There is no magical hot pack. Okay? If somebody goes to a practitioner, sports therapist, I don't care what you call them, massage therapist, and you are not doing the physical portion of your rehabilitation, you're not doing real rehab. So basically, what I'm saying is the person needs to start off by getting evaluated for that injury by the right person, which is most likely a doctor of physical therapy. Then a program specific to your needs has to be established. So eventually, if you're going through time and you're lying around a table doing, little arm exercise with a TheraBand and there's some magical hot pack on you and you're still doing that 1 month into your program, you are missing out and you will never be back to doing martial arts or self-defense or even playing pickup basketball. So your rehab should be focused on getting you to do specific things that your body needs to be able to heal. They need to be functional, they need to be active, and it has to be dynamic.